Welcome. If you're watching this video, it is likely that you or a loved one is preparing for a CT-guided lung biopsy. We understand you may be feeling apprehensive and hope that this guide helps by allowing you to learn more about the process before your appointment.
Morning. Hello, morning. So I'm Estelle, one of the nurses.
A CT-guided lung biopsy is a minimally invasive procedure that allows doctors to obtain a small sample of lung tissue. This helps diagnose various conditions including infections, inflammation and tumours. Your doctor may recommend a lung biopsy if imaging tests like X-rays or CT scans show an abnormality in your lungs. The biopsy helps in making an accurate diagnosis so that we can decide on the most effective treatment for you. Before your biopsy, you'll receive specific instructions. These will include fasting for a few hours and stopping certain medications. Make sure you follow these instructions carefully, but do not stop taking blood pressure medication. It is very important to ensure that your blood pressure is controlled on the day of your procedure. Hi Rolly.
Good morning.
My name's Arzu Rezvani, I'm one of the radiology consultants. On the day you'll meet the radiology doctor before the biopsy. They will explain the procedure to you in detail and you will have the opportunity to ask questions or communicate any concerns or worries you might have. Please tell us if you or anyone in your family has ever experienced prolonged bleeding after a medical or dental procedure, and bring in your regular medications with you, even those you've been asked to stop taking for the biopsy.
So my name is Bibin, one of the radiographers, and I am working with Renju.
For the procedure itself, you will change into a gown and lie down on the CT scanner bed. Exact positioning will depend on the location of the abnormality, but we will spend some time ensuring you are comfortable. This maximises the chance of a successful biopsy by enabling you to lie still throughout and to reduce the chances of you needing to move. Are you comfy now? You don't need anything under your knees? Yeah? Okay. So once we've done this, as still as a stone for me, and remember those breathing instructions. All right, let's go. The radiology doctor will start with a planning scan to work out where on the skin the biopsy needle will be inserted. Can you put that on the... And after this, that area is cleaned and numbed with a local anaesthetic. The local anaesthetic stings when it first goes in, but this stinging only lasts a few seconds. After the stinging wears off, you shouldn't be able to feel any painful sensations, but you will still have other sensations like touch or movement. If you do feel anything painful or sharp, please tell the doctor straight away and they will give you more local anaesthetic. After the planning scan, a series of very tiny CT scans will provide images that help the doctor to position and move the biopsy needle to the precise location in your lung. Did we do that on a breath hold, Rolly? During every scan and whenever the doctor moves the needle, you will be required to hold your breath. This is just to stop the lungs moving, but don't worry as this will only be for a few short seconds each time. Once in place, a few tiny samples of tissue are collected. You might hear some clicks at this point. After the radiologist has collected enough samples, they will remove the needle and place a sticking plaster over the biopsy site. Being a minimally invasive procedure, you will only have a very tiny cut in the skin, just a few millimetres long, and this will heal in a few days. Lung biopsies are usually very well tolerated and shouldn't be very painful. In fact, for most patients, the most painful part is the local anaesthetic injection. The procedure takes on average about half an hour, and when it's finished, you'll be transferred back to your bed in the recovery area for monitoring, and one or more chest X-rays.
We're back in daycare now, so all you have to do is just chill out.
This monitoring or observation period takes 2 hours and allows us to ensure there are no complications. Most people will go home after these 2 hours, but if you develop a complication, you may have to stay longer. On rare occasions, you may need to stay with us overnight, so please do bring some overnight essentials just in case. When we discharge you home, we like you to have someone to support you for the first 24 hours. If you live alone, you should arrange for a relative or friend to stay for the first day and night. It's important to take it easy for the first couple of days after a lung biopsy, but you'll soon be back to your normal levels of activity after that. If you've had to stop any blood thinning medications, you should restart them the next day. Like any medical procedure, a CT-guided lung biopsy has some risks. These risks include bleeding, infection, injury to other structures, and pneumothorax, which is where air leaks into the space between the lung and the chest wall. These will be explained to you carefully to ensure you understand them before starting the procedure, but in the meantime it is important to remember that we as doctors only advise any investigation or treatment when the benefits clearly outweigh the risks. You should also be reassured that we take steps to minimise these risks to as low as we can get them, and that we are well prepared to manage any complications. Your biopsy results will usually be available within a week. Your doctor will discuss the findings with you either in clinic or by telephone and explain the next steps, whether that's further treatment or additional tests. We hope this video has helped you understand what to expect during your CT-guided lung biopsy. If you have any more questions or concerns, don't hesitate to contact your doctor or specialist nurse. See you on the day.